You simply upload the image and download the report within 16 seconds. Hi everyone, I'm Paul from Alpha Intelligence Manifolds. We are here to introduce how to use the report portal to generate the osteoporosis report based on lumbar spine and hip images. So this is our report portal, and its usage very simple. You simply click the add button here. Then you select the image that you want to upload. You click open. It will go to a quick snapshot for you to check where the report type for each image. As you can see from here, the thumbnail for each image. This one is for hip, okay. This one spine, yes. And this spine and hip, okay. And you also need to check the gender and the age information. Once confirmed, it's okay, you can click upload. Right now, the image is uploading to the cloud. It just take a while. After complete, you will take the next step. So here in the page, you will see the analyze progress. Normally, it would be done within 16 seconds. So, once it is done, let's wait for this one. Once it's done, right now you see the green part, analyzed okay, report okay. And right now, preview button is clickable. Then you can click the report button. You can download report directly. And the first thing you can see from is the report title. It's very important to make sure the patient name, patient age, and this information is correct. So we are analyzing the correct patient. Then we go down, you can see from the fracture risk category. It's the most important classification based on WHO guideline, normal, osteopenia, and osteoporosis. Then you go down here, you can see the bone mineral density based on the ISD guideline. For hip part, we will provide the neck bone mineral density and the total hip bone mineral density. And based on the ISD guideline, we use the enhanced database to convert to T-score here. You can see from the neck is -0.2 and the total hip is 0.9. And furthermore, we will base on the enhanced data to convert to the Z-score to compare with the paper at your age. For the right part, we have a reference chart here. For these patients, he has go to this clinic 45 years old, 55 years old, and 67 years old. So you can see the clear result of the patient's bone mineral density progression over these years. This is very useful because you can see a sudden drop at this stage. So doctor can see the sudden drop, then can based on it to provide a personalized treatment program. And the bottom part of this, you see the source image information. This is important for you to check again whether the patient name, sex, and birthday, this information correct or not. The second thing is that you also, in the image at the left side, there's a orange square here. It's the ROI, region of interest. You have to make sure that the region of interest covers the hip part. If the region of interest does not cover the correct part, then you should not use the report. That's the first part about the report itself. The second part is about the personalized information for the Vietnam market. Here we provide a small introduction about these WHO classifications and how we're gonna use to do next step. This is for hip. Okay. And later let's go to the spine report. You can see spine report here. You can click. So here you see. So still first we need to check the patient name and patient age, and the fracture risk category. And this part you will see the bone mineral density of each L1 L2, L3, and L4. Also, the combination of the different regions. By ISD guideline, the bone mineral density for lumbar spine, you need to have at least 2 body parts. Based on guideline, you need to remove items such as with implants or items if there's some vertebrae with severe compression fracture. So if the patient L3 part has severe compression fracture, then we should remove this. Then we should have L1, 2, 4. So for this patient, if the L3 has issues, then we remove it with L1, 2, 4 with the bone mineral density L by 1.214 and T-score 0.3 and Z-score 0.7. And on the bottom part is very important. The left side is the reference chart for us to have a longitudinal tracking of the patient's bone minerality progress. And the right side also the image and the region of interest. We have to make sure the region of interest covers L1 to L4. And so the bottom part, we also have the quality check result. If it sees no issue, no quality issue, then it's good. Then we can follow up to the next. It's about the reference information for Vietnamese people. So I basically here right now I cover the hip report and the spine report. Our product based on clinical guideline, we also need to cover the critical case. Now give this for example. This is for image with an implant. You can see from here. Let me go down here. This one, right side is okay, and the left side is okay. Right side with a big implant. So based on the ICD guideline, if the image with the implant, it should be ignored. So AI will detect automatically. If we found the implant, you can see the right part here. We don't see any volume. It's based on the ICD guideline. So for this patient, we can still analyze the left part for the bone mineral density for neck, total hip, and we can also see the reference chart at the right side. So in summary, Deep X-ray product help you use your clinical current plane X-ray for lumbar spine and hip. We generate bone mineral density. So we're able to detect the osteoporosis high-risk patients at early stage and convert them into treatment. And our product follows the global ICD guideline. And our workflow is very simple. You simply upload the image and download report within 16 seconds. And thank you for your time. 谈边。